Hi, everyone. Welcome to our May 2022 Ask the Expert interview. Today, I have Nurse Practitioner Michelle Vittitow with us. She is with Family Allergy and Asthma. And a lot of people suffer from allergy and asthma, being just where we are here in Kentucky. So just wanted to talk with her today and get some tips from her on how to best deal with these seasonal allergies and asthma. So we'll kind of kick it off with allergies. So what are the most common symptoms that you see that come in through your stores?
Absolutely. So first of all, you're right, Ohio Valley, right? We hear a lot about allergies around here, but you know, allergies they're very typical. Allergies very common. More than 50 million Americans suffer from allergic rhinitis. That's a big number, right? Patients will typically come on our door with having symptoms of sinus pressure and pain. They'll have itchy, watery eyes, congestion, runny nose, drainage down the back of their throat, sneezing. Some will complain of like their ears full, popping, crackling. Some will say, oh, they're itchy. And then we'll also get patients who have those lower respiratory symptoms. So they'll cough, they'll wheeze, they'll feel short of breath. And I have some patients who have itchy skin or they'll have rashes. So it can vary.
Yeah, so kind of a wide range. I think I'm personally one of the allergic to everything's on the allergy test, so I have a little bit of all of that. So kind of what are some common recommendations for individuals that are experiencing, just some of these symptoms?
Oh, gosh, yes. So for anybody experiencing these symptoms, absolutely, I do recommend that you seek out a board certified allergist. That way they can help you identify what your environmental allergens are. And they can do that and then also help you identify, okay, what strategies can we use to help avoid these, right? Also very important is medication management. And they can help with that because they can help to identify, okay, what symptoms are you having, and pairing up with those symptoms the right medication, because so many times I'll see patients come in with certain symptoms and they're given an allergy medication, but it maybe isn't lined up with what that symptom set is that they're having. And lastly, of course, what allergists can absolutely do is when they identify those allergens, they're able to give allergy immunotherapy, which are allergy shots, right? So what that is where we give you small doses of your specific allergens, right? What you're allergic to. Give that in small doses over a period of time, essentially creating immunity. So turning off what's going on in the background that's actually giving you the symptoms that you have.
Okay. Just if you can, just go just a little deeper in kind of someone coming into the office. What's the process of going through the testing and then getting to that point where you're getting the shots?
Okay, so actually for that first time that you come in to see an allergist, I would say plan for a couple-hour visit. It's actually very thorough. So we take time to get a very good patient history. We want to know what's gone on over time in that background and how long it's gone on. We'll ask you a lot of specific questions about your symptoms. And of course, we do a thorough exam, making sure that we're looking at everything that we need to look at. And then also we can perform allergy skin prick testing in the office that same day. So essentially what that looks like is we have little skin prick testers that we dip in those common allergy serums. So think all the things we think about here, right? But you think dust mite and animal danders and also the mold spores and all the pollens, so trees, weeds, grasses, and then ragweed. So we dip those in and then we tap them to the back. The patient will get it looks like a red itchy whelp. We put controls on there so we know what a negative and a positive look like. We're measuring those. Okay, at that point, we would be able to say what you're allergic to or not. For some patients, we may move to the arm for a second level of what we call intradermal testing. That one is more of a small needle, but the allergist could help us decide if that's what they would want to do that day. At that point, though, by the end of that visit, we can say what you're allergic to, help with the things that we talked about before, medication management, environmental controls, as well as are you a potential candidate for allergy shots. So it's a pretty big visit. For patients with lower respiratory symptoms, I will also point out we do pulmonary function testing in the office. So we would also do that as well that day if we're looking at, does the patient have asthma or some other lower respiratory condition?
Earlier you mentioned just some common allergens. So is there any tips that you have to try to avoid any of those that are, possible?
Wow. So we could probably spend a whole session just talking about that, right? So quick tips I'll try to give you here, not inclusive though. I always think about, we spend a lot of our time at home, right? So the first thing I would think about is in the home, what you can do. Keeping humidity levels at less than 50% is really great for reducing that out as far as dust mite, contact it, and also mold spores. So that definitely keeping that humidity level low. Wall-to-wall carpeting, if you have it, if you can remove it, great. And then don't install it if you don't have it. That can also be helpful with that. And of course, stuffed animals, pet bedding, that kind of thing in the home can also increase the dust mite exposure. And so washing those, if you can, if they're washable, in hot water, drying them for about 20 minutes in the dryer on high heat will help to lower that. And I hate saying this last one, but it is so important, especially this time of year. But keeping windows and doors closed, right, on these beautiful days, because absolutely during peak seasons, you're letting all those pollens and everything into your home. Okay, so I have to say that. And then also, if you are doing yard work, and especially this time of year, right, wearing that N95 mask to help keep those out. So those are some quick tips.
Do you have any, we're the Kentucky Lions Eye Foundation, so we're always trying to relate things to eyes. So just wanted to ask about like suffering from itchy eyes. I know like I have personally had a little bit of damage, my eye doctor said, just from rubbing them so much in the summer. But is there anything to, other than just keep your hands down and don't scratch your eyes? Anything to protect eyes that you know of from getting this type of thing?
Sure. So I do always recommend, if anybody's experiencing itchy eyes, don't try to just kind of deal with that yourself, right? I would always want you to talk to your provider or eye doctor and allergist, and making sure that it's whether it's allergy or dry eye or some other condition, right? Making sure that it's evaluated by a provider. But generally, if we're speaking on the allergy side, I would say washing your face, your eyebrows, your eyelids, especially if you've come in, this time of year, getting that all off is going to help, because if you think about it, those areas will harbor those pollens, right? If you are out in the yard, wearing eye goggles, right, to protect your eyes when you're doing yard work. And then also, of course, there are allergy eye drops out there, and discussing with your provider whether those would be a good option for you. Yeah.
So we'll kind of move on to asthma, kind of the other half of what you all do. Just tell us a little bit about any symptoms that someone may have that they don't realize they have asthma. What are some of those first symptoms?
Yeah, that's great. So asthma, a lot of times patients will come to us and that they are experiencing coughing, wheezing, feeling short of breath. Okay. Now this can happen. They can be waking up in the middle of the night with these symptoms, or early in the morning with those. They can also have these symptoms when they're exposed to actually the environmental allergens we've been talking about. When they're exposed to those, they will have a flaring of those symptoms. So the other piece that we'll see too, of course, with viral illness is sometimes that will flare patients' symptoms as well. So those are the main complaints. But I would point out too, a lot of times we won't see these patients until they've had several hospital visits or ER visits for breathing issues. And so yes, if the earlier they can get in the door, the better.
Okay. So what are the common ways to treat asthma?
Okay. Common ways to treat asthma. So I always think about it in a kind of stepwise fashion here. So when you think about acute asthma treatment, right, what you're doing is you're wanting to open up that airway. Okay, so a lot of times for patients, you have that constriction in the bronchioles, right? So coughing, wheezing, and short of breath. Albuterol is the rescue inhaler, and it has many names, right? But it's the rescue inhaler used to open up those airways. So that's what you would use initially for an acute treatment to relax the smooth muscle in the lungs and open things up. But then when you talk about the management of asthma, right, so that's more on the day-to-day control, preventing exacerbations. Then you want to think about reducing inflammation in the lungs. So this is where, for some patients, we would put them on a daily controller therapy, which may have an inhaled steroid in it that ultimately will reduce that inflammation. Plus, sometimes it'll have what we call a long-acting beta agonist, which will keep the airway open more through the day, reducing the need for that albuterol inhaler. And then the other thing on that day-to-day management is, honestly, we've talked about avoidance of allergen triggers, but it's identifying what they're allergic to, avoiding that, and also potentially treating with allergy immunotherapy to reduce their risk there. I'll point out, over the past several years, really, there's been emerging therapies too with what we call biologic therapies that are an option for our moderate to severe asthma patients. That is another treatment option for patients where initial therapies aren't working. Those can be very helpful.
All right, thank you.
Mm-hmm.
I know, similar to allergies, I'm sure, but just common tips to help avoid asthma attacks.
Okay, absolutely. So you're right. Avoidance of the allergen triggers we've talked about, or irritants in the air, and also avoiding secondhand smoke. Super important there. Staying inside on poor air quality days. And lastly, honestly, what we've seen with this pandemic, right? But patients don't always think about this, but limiting your exposure to acutely ill patients, whether that's a cold, a flu, other viral respiratory illness, or COVID, it's super important.
Kind of looking from the outside in here, I guess, if we're around someone who may be having an asthma attack, is there anything that just in general someone should know to kind of be on the lookout for, or I know that inhaler is what they need, but is there anything others can do to help?
Well, that is what you can do to help, in fact. So the first thing that a patient really does need is to get their rescue inhaler. So if you can help them to help find their rescue inhaler, get access to it, that's what they need. If you do find, though, that they don't have their rescue inhaler, or if it doesn't seem like they're responding to it, they didn't have improvement in symptoms after using it, absolutely, that person needs to be taken to an emergency department.
Okay. Well, thank you so much for talking to us today just about allergies and asthma. I know it's a lot of, something that a lot of our viewers go through and deal with on a daily basis. So I'll just let you wrap up if there's anything else that you want to share about what you all do, or about your practice at all. Just now's your chance.
Okay. I just want to point out, we actually offer treatment to all ages for allergic and immunologic conditions. I mentioned we perform lung function testing as well as allergy testing, but we also offer some of the newer biologic therapies that I mentioned for treatment for patients with asthma. We have over 60 locations, ever growing, in multiple states at this point, including 18 just in the Louisville metro area. So a lot of access to patient care, which I'm personally very passionate about. I think it's amazing. We absolutely have board certified allergists, which is very important. They go through a lot of extra training and have a lot of knowledge. And our team of providers and nurses, they really are passionate about not just, obviously accurate diagnosis and treatment of these conditions, but we really do want patients to have better quality of life. And we can do that with treating allergies.
Yeah, well, sounds great. Thank you so much for being on with us today. We have Lions clubs all over the state and then all throughout the United States. So I know that they'll be interested in learning about what you all do. So thank you so much.
Happy to do it. Have a good day.
All right, you too. Thank you.
Bye.